Good afternoon. Thank you for joining us for the Oley Foundation webinar. You need self-care. What can I do to cope with being a caregiver to a loved one on HPEN? My name is Andrea Guidi. I am the Executive Assistant for the Oley Foundation. Most of you are probably familiar with the Oley Foundation, but just in case this is your first experience, I'd like to briefly introduce the organization. The Oley Foundation strives to enrich the lives of those living with home nutrition support, both intravenous nutrition, sometimes called HPN or TPN, and tube feeding. We do this through education, outreach, and networking. The Oley Foundation was founded in 1983 by Dr. Lynn Howard and her patient, Clarence Oley Oldenburg. Today, we serve approximately 20,000 members. All of our programs are free of charge for patients and their families. Before we start the presentation, I'd like to go over a few housekeeping details. You should see a toolbar on the right side of your screen. Click on the orange arrow to show the control panel. In the question section, you can type any questions you have for me or for the presenter. Please note we will not be responding to the hand-raising function in the control panel. We will answer as many of the questions as possible during the question and answers period at the end of the presentation. We'll post a recording of the presentation after the webinar on the Oley website. Please note that we have muted all the participants, so you don't need to worry if there's background noise where you are taking the webinar. Now for our presentation. It gives me great pleasure to introduce today's presenter, Dr. Tiffany Taft. Dr. Taft is a clinical psychologist from Chicago, Illinois, a research assistant professor and director of psychogastroenterology research at Northwestern University Feinberg School of Medicine, and founder of Oak Park Behavioral Medicine, a private psychology practice specializing in treating patients with chronic digestive disease. She has published extensively on psychosocial aspects of digestive diseases with interest in stigma, fatigue, and post-traumatic stress disorder. Dr. Taft presented psychosocial issues related to intestinal failure at the Oley UI Health Combined Conference in Lincolnshire, Illinois this past June, and an edited transcript of an interview with Dr. Taft on the subject of PTSD was published in the Lifeline Letter September-October 2018 issue. We are thankful to have you presenting with us today, Dr. Taft. I will turn the presentation over to you now.
Great, thank you so much for having me. I just did another webinar about a month ago to consumers, and so I'm excited to be talking to caregivers this time on strategies to coping with taking care of somebody who relies on home nutrition. And Andrea, I just want to make sure you can see my screen okay before I go.
I can. You are all set.
Okay, great. So just a couple of disclosures. As Andrea mentioned, I am the owner of Oak Park Behavioral Medicine, which is that private practice that I have outside of Chicago. And I also do some speaking on physician education and communication for AbbVie. So Andrea mentioned my background, and I do work with patients living with digestive diseases, and I also do research in this area here at Northwestern. And just a bit of personal disclosure, I've had Crohn's disease since 2002, and then I was also diagnosed with eosinophilic esophagitis in 2016, which apparently there is a growing body of people that have that overlap. So it's a interesting development in the digestive disease world for sure. So I come to you with mostly my expertise as a researcher and a psychologist, but also an understanding of somewhat what it's like to live with these conditions and on a restricted diet. So today I want to go over the psychological impacts of being a caregiver. There is a lot of information online and a lot of resources available for caregivers. I'm sure you've probably gone and looked for some, and you may have noticed that a lot of these are geared towards people taking care of people living with Alzheimer's or dementia, kind of children taking care of their elderly parents. And while a lot of the concepts from those groups are true for all caregivers, there's also unique aspects, I think, to what you're dealing with and caring with someone on home nutrition. Quick background on what clinical health psychology is, so you can see where I'm coming from the scientific perspective, and what are some of the treatments that we use and how you can implement these on your own. So caring for the caregiver, I think is an important topic that sometimes gets put on the back burner because the person of focus is the patient. We want to make sure that that person is doing well, is getting to all their appointments and getting all their treatments. And sometimes, the caregiver being pivotal in that kind of gets their needs get put second. And we really want to make sure that there's a nice balance of your care and the care of the person that you're tending to. And the to-do list for caregivers is often quite extensive because you're navigating your own job or other family members, and trying to manage all the things that come with taking care of someone else. So taking care of ourselves often, becomes a low priority. And so to be an effective caregiver, we have to have what we call clinical empathy, which is different from sympathy. So sympathy is I feel bad for somebody, going through something particularly difficult, where empathy is the skill of understanding what a person says and feels. So really putting yourself genuinely in that person's shoes and then effectively communicating this understanding to the person. So it's like, I truly understand how you are feeling. I can really put myself in your position and I can see how hard it is. And to be a caregiver does require some degree of empathy, and not everybody is born with a lot of empathy skills, and we have to learn sometimes how to be empathic, and it can be exhausting to be empathic all the time. So even professionals such as myself struggle. There's a concept in medicine and also in psychology, we call it burnout, and it's kind of a hot topic among physicians right now because it's really hard to maintain that degree of clinical empathy needed for the day-to-day care of another person. And so our self-care becomes critical. And this is a nice infographic that I found online about what burnout is. And so it's not because of stress on its own. It's a lack of support and resources to help you deal with the stress of life. And so when caring for someone on home nutrition, we need support and resources. So this infographic is more geared towards like a physician, for example, but a lot of these apply to people in caregiver roles as well, because you might not have the medical degree and you're not working in a clinic, but you certainly are doing a lot of things that someone in a medical profession is doing and you're doing it every day. So it's really the highlight of a lack of support and resources that we want to focus on, because there is just going to be stress in life living with home nutrition. And so this is a nice representation of how stress is good for us up until a point, including a balance, between our emotional center of our brain, or the amygdala, and the thinking part of our brain, or the prefrontal cortex. Stress motivates us. It gets us out of bed. It got me to come to the office today. It's not always a bad thing. But as you can see, as the chart starts to go over the peak in terms of intensity, our performance or our ability to do things starts to go down. And so then we start to set into exhaustion or even panic, or just completely breaking down. And this is not just our physical well-being, but our mental well-being as well really starts to degrade when we go across that peak of this curve. So we want that healthy tension because that helps us get stuff done and keeps us motivated. But we don't want to tip especially towards that far end of the right side of the chart. So how do we do that? And if we do tip over to the right side, how do we get back to that healthy tension, creative calm, if you will, area? So there is something actually called caregiver stress syndrome. I did not make that up. That is a researched term. You can Google that and you'll come up with studies that are looking at caregiver stress syndrome. And it's really a cycle that people can get into, starting with the work of caring for others. You can have grief over the loss of health and almost set into physical and emotional symptoms of chronic stress from hormones that are released in the body, similar to people with post-traumatic stress disorder. So we think of people who go to war or are involved in a bad accident or a crime, are people that get PTSD. But the chronic, stress of being a caregiver can push people's bodies and brains into this similar physical and emotional state of someone who just came back from war. So I mean, that's a pretty dramatic thing to say, but it's true that caregivers can really be put into highly stressful situations where they may feel it's very hard to cope. So what are some of the signs of caregiver stress syndrome, both physical and emotional? So the physical can be sleep disturbance. It can either be you need to sleep too much or you can't sleep, you have insomnia. You might have weight fluctuations, frequent headaches, digestive upset because of that brain-gut connection. You can get a slew of physical symptoms that come from just being under chronic stress. You can also feel overwhelmed, irritable. You might not be able to be as patient as you would like with your loved one. You might not be as interested in some of the things that bring you joy or pleasure. You might feel like I can't do that because I need to be fully engaged in my caregiver role. I don't have time to do those things. Even sadness, chronic sadness, depression, and seeking substances to try and cope, because substances are quick ways that don't require a lot of time, but they obviously don't help situations in most cases. And I wanted to put a little bit of a quote here regarding our virtual world. Andrea and I were just talking about this before the webinar started of, we're in the bridge generation of, we had what they call an analog childhood and a digital adulthood. And how has, the online community, the internet affected the role or the life of someone, not just everybody, but also specifically caregivers? How do we interact? Has the new technology created more meaningful, experiences online? I'll get into this a little bit more later in terms of coping and using online resources to help. But we're thinking about now in today's world, you have connections with people through technology and information through technology, and what are some of the pros and cons when it comes to caregiver stress and coping that we see. So now that I've kind of gone over some of that basic background, what can we do? So as I mentioned, I'm a clinical psychologist, and I specialize in health psychology, which, just like in medicine, psychology has these subspecialties. So you have, cardiology and gastroenterology, neurology and medicine, and in psychology you have the same thing. So this is a field of psychologists that are interested in understanding health and illness and ways to help improve people's lives and reduce the impacts of illness on quality of life through behavior, psychological, and biomedical science. So this is a large area of psychology. There are societies and journals. So sometimes people don't really understand that this is a specialty just like in medicine. So we look at improving the lives of people with chronic medical conditions and also helping their caregivers. And, unfortunately, Dr. Phil, puts forth an image that these things are pretty straightforward and easy. And what I think we all recognize that that's a bit hyped, but it really is a lot of work to do some of these things. But with time, and practice, you can definitely implement some of the strategies that I'm going to go over today, even things that you maybe have tried in the past, but maybe gave up on because they didn't feel like they were working. The basics of self-care, though, is taking time for yourself, taking breaks, and setting limits on the time that you spend in your caregiver role. And then the last one, which I made bold and red and underlined, is setting boundaries with people. I think this is something I talk to caregivers a lot about, like, how do I set boundaries now when maybe I've been loose with them in the beginning? So the precedent has been set that I am available all the time because I felt like I needed to do that, but now I can't maintain that anymore. So how do I walk that back and set boundaries with people? And that definitely is a lot harder to do than setting boundaries up front. So unfortunately, I don't, people on the call or on the webinar thinking about where are my boundaries with the people in my life, including people I'm a caregiver for, and am I comfortable with that, or do I feel like I need to start walking those back? And that can be a challenge, but it is something that can be done. And then if you start new relationships, setting those boundaries out of the gates is definitely the easier approach, because then you don't have that precedent that is set. So what I'd like you to evaluate as I'm talking today is 3 things. And the first is your social network. Who are the people in your social network? Who can you count on? But also who might not be the most helpful? And I think sometimes, at least in my personal experience with illness, my social network isn't who you would assume all the time. So my go-to people might not always be my family members. It might not even be my best friend. It might be someone that just understands my situation better and I can connect with, and they're more capable of being empathic with my situation than, the people that you would expect to be. So I think dealing with illness, being a caregiver, is a pretty, good way to find out who your people are in your life, and people who maybe aren't. And if they aren't helpful, are they people that you want to keep on the periphery, maybe not in your inner circle, or are they people that you need to, say it's time for us to move on in our relationships? And those can be very difficult decisions, but can also be very freeing if the person, that you might be thinking about is particularly difficult. Also, what online resources do I use? So kind of going back to that quote of, we have all this technology, is it really making things better? And I would argue that yes, it is better to be able to connect with people. The fact that we're on this webinar, talking about this is a great example of a good use of technology. But there are a lot of message boards, there's Facebook message groups. So again, what are you using for online support, and is it helpful? And really, how do you feel after you use them? If you're reading a Facebook group, feed, and you feel your shoulders like inching up to your ears because you're reading all these horrible stories, it might be time to step away and say, maybe this isn't making me feel better, or helping me get the information that I need. I always advocate in my patients to set limits on the amount of time spent online, whether it's researching information or, in a group such as that, because you can kind of go down the rabbit hole sometimes. So really checking in with yourself and saying, how do I feel? I'm feeling kind of icky. I think it's time for me to, go do something else. And then also, how is my relationship with my family member's doctor? So as a caregiver, you might be going to doctor's appointments. Do you feel like you can communicate on your family member or your loved one's behalf? Do you feel like the doctor listens to you and your concerns? Are you a member of the team? Do you want to be a member of the team? Really looking at that, because we talk about doctor-patient relationship, but I think there's also doctor-caregiver relationship, and that's an important piece as well of your social network. Also looking at, am I taking basic care of myself? So before I can make changes in my life, I got to evaluate what I'm doing, and look for areas to work on, because not everybody's going to have the same needs. So what are you doing right now to de-stress? And I think the follow-up is, does it actually work? I have people that come in and tell me, oh no, I meditate all the time. And when we start talking, it's like, is it really helping you? And they're like, not really. I don't feel any better. I'm just doing it. It's like, well, why are you doing it? Well, because people tell me I should. And it's like, well, okay, but it's not just doing the act, is am I getting anything out of it? You know, if you're not exercising regularly, if you're physically able to, what is keeping me from doing so? And, you know, we do know that exercise, even walking, especially out in nature, is really good for our mental and physical well-being. How's my diet? How's my sleep? And how much downtime am I really allowing myself every day for me to engage in a meaningful activity that has nothing to do with caregiving? And if you can't quantify that, you know, right now as I'm talking, maybe spend the next week just doing what you would normally do before making any changes, and just add up, how much downtime do I actually get in a given day or a given week? And if that number is pretty low, then it's a sign that it's, you know, a good idea to start looking for carving out more time for things that recharge your batteries. So again, kind of a quick checklist. What have you tried? What works and what doesn't work? And then starting from there. And everybody's is going to be different. Some people like to knit or crochet. Some people do yoga. Some people go for a jog. Like, there's no one size fits all answer. It's really what fits into your life and what do you prefer and what can you actually do. The other third part of things I'd like you to look at is your thoughts, or your automatic thoughts, as I've put in these little thought bubbles. These are things that we call cognitive distortions or thinking traps that everybody does, even myself. Even the experts do mind reading and catastrophic thinking, and they're pretty much what they sound like. So catastrophic thinking being, I am going to expect the absolute worst case scenario. So you are preparing to go to a follow-up visit with your loved one's physician, and you are just expecting the absolute worst case scenario. And the hard part about that one is sometimes we're right. Sometimes the worst case scenario does happen with these illnesses, for example, and it's like, okay, see, I was right. And the second part of catastrophic thinking is, I also am going to grossly underestimate my ability to cope and handle that situation. And that's what causes the anxiety, because bad things happen, but you've also coped through a lot. I'm assuming, depending on how long you've been a caregiver, you've been through kind of, you know, the really difficult situations, and maybe it wasn't very pleasant or it was downright awful, but you're still here and you'll do it again. And so we often forget how resilient we are in the moment because we're so worried about the worst case scenario. Another one, you know, is negative filter. So I'm going to filter out anything positive that might happen, and I'm just going to focus on the negative. Or mind reading. So-and-so must be thinking X, Y, or Z about me. These are all things that every person walking around does to some degree, and they can really cause us a lot of undue stress, anxiety, or even depression. So these are things that we can target and change, which I'll get into in a little bit. Another thing that I hear a lot when I try with caregivers to make changes in their life is that I would feel guilty if I wasn't there enough. Or I did that once. I went on vacation, you know, I took a short weekend getaway, and then something bad happened with my loved one and I wasn't there to help them, and I just feel so bad about that. I don't ever want to do that again. You know, but guilt is a tricky emotion, and it doesn't really suit us to make any meaningful change or do things in a different way, because it implies that I did something wrong. It also implies I did nothing to fix the wrongdoing, and it also implies that I haven't changed my behavior. And so is is that true? So is my thought process, you know, accurate, why I'm feeling guilty? So when patients say to me, I have a lot of guilt. So I'll say, well, what did you do wrong exactly? And they're like, well, I wasn't there, when something bad happened. And I'm like, well, is that, something to really is your fault, or is that just something that happened? And why do you have to take your needs and put them aside all the time? So it opens up a discussion of what the guilt, is, where it's coming from, and then what is the person doing, and also are your expectations for yourself reasonable? And then the last one is a little bit dicey of a question that, can be offensive. But does having perpetual guilt serve any purpose? And sometimes when I ask people that, they spend some time thinking about it, and they'll say, well, my guilt motivates me to keep going because I feel so tired and so burned out that, at least if I feel bad, I'll keep going. And that's not really a great reason, because that causes all sorts of other issues down the line, like resentment, anger, frustration, things of caregiver stress syndrome that I mentioned earlier. So I'm going to now jump in to self-caring strategies that I think most people can learn on their own, or use the wonderful technology that we have through apps and things like that. So there's a big push in what I see on social media for relaxation. Yoga's a big thing, meditation's a big thing, and a lot of people I like this cartoon because, like, people are like, okay, let's go. I need to learn how to relax. How do I do this quickly? I'm a caregiver. This isn't just specific to caregivers, but in this context, I don't have a lot of time. Like, what do I got to do? I got to learn how to relax. And it's like, okay, well, the easiest thing to start with is diaphragmatic breathing. And the reason that diaphragmatic breathing is physiologically a powerful tool, it is the only way, or the only thing that we have control over, voluntary control over, that can affect involuntary bodily functions like heart rate, like blood pressure, like body temperature, especially in your hands and your feet. If you have cold hands and feet a lot, that means that's an indicator of stress, because your capillaries are constricted and the blood flow isn't getting to your fingers and your toes. By doing some simple, slower, deep breathing, which is a skill, most of us don't breathe like this regularly, your hands and your feet will get warmer. So when we do biofeedback with people, we hook them up to the computer and they show the different, the heart rate, blood pressure, temperature of your fingers, you can actually visually see those temperature changes. So learning how to deep breathe sounds kind of simple, and you're like, that's all I'm getting out of you, Dr. Taft? That's great. I say, yeah, and it's hard to do, and it's going to feel weird if it's not something that you've practiced. The good news is there are free apps. The one I like is called Breathe to Relax, so the number 2. It's free, and I believe it's cross-platform, and it teaches you paced breathing. And so you can say, I want to set my breathing pace to 10 breaths per minute, which actually isn't that slow, but is slow for a lot of people starting out, with the goal of getting down to about 6 or 7 breaths per minute, which is actually quite slow and would feel very uncomfortable if you just started doing that out of the gate. So you want to kind of walk it back using this technology, because it causes our nervous system to calm down, but it also helps our mood, our worry, and kind of our hypervigilance to our surroundings. So this is the most basic starter thing that you can do, and you can definitely learn this without the help of a psychologist. So here's an example of how to do belly breathing, and it's basically putting your hand on your chest and your stomach and breathing at a pace that is comfortable but slower, and that's where that app can happen. And just doing this repeatedly a couple times a day when it's not your peak stress time. So if you try to implement relaxation strategies when you're at a 9 out of 10 on the stress scale in your body, it's not going to work. So you want to try this when you're feeling a little bit calmer. And so then you can really kind of get your body adjusted to. And I say it takes about 2 weeks or so for your body to start to feel like, oh, this actually feels normal to me, if this isn't something you've done. And you'll start to notice muscle tension will get better. You know, you might feel calmer after you're done. And I love belly breathing because you can do it anywhere at any time and nobody will know that you're doing it. So it's a very portable skill as well once you get good at it. And yes, you should try meditation. This is a little bit more of an advanced thing. So if you want to do meditation, you got to learn the belly breathing first. Once you master that, after a couple of weeks, if you want to try meditation, it has many, many benefits that I think some are overhyped. You know, meditation is a very big, you know, buzzword these days, but it really does help. And we know through clinical trials that we can see physical changes in the body after people meditate. And again, it's this practice 3 to 4 times a week, setting aside that time to do it. Again, not when you're having the 5-alarm fire, but you know, usually I tell people to practice before bed, you know, and just letting yourself relax. There are many guided meditations. I don't recommend trying meditation without any guidance out of the gates. It will be weird and your mind will start thinking about your grocery list or the 87 other things that you have to do after about a minute, and you'll give up and say, I'm too distracted, I can't do this. If you get an app, and there are many meditation apps available, it'll guide you through it. It'll feel a little bit easier. But again, at least 2 weeks of practice before you're going to start to notice any type of it feeling more normal and noticing any type of effects. So these are some of the apps that are out there. I don't get any cut on any of these, but these are just some that, you know, I've recommended to people. Some are a flat fee where you just pay for it for about $5, I think, and where others like Calm is in-app purchases or subscription service. I found out this year that my daughter's in 3rd grade and they are using the Calm app for mindful minutes in the morning. And that Calm actually gives the schools a break on the app. So widely used, pretty popular, gets highly rated. But Headspace, Stop, Breathe, Think, all the Buddhify are all great options, whatever one you like the best. So it is a skill. It takes regular practice, and it does cause structural changes in your brain after 8 weeks. So in the research that we do on this, over on the right side, it shows all the areas of the brain that are affected through meditation, including that frontal lobe, the thinking part of your brain, the gatekeeper of the senses or the thalamus, the hypothalamus, all these kind of primitive structures of the brain that are involved in emotions and stress. They all change after 8 weeks in ways that cause people to feel calmer at their baseline, even before they're stressed out. And so we do know that it's not just, oh, I feel better, but the brain does start to change after about 2 months. So I also want to talk about something called cognitive behavioral therapy, which uses the relaxation tools that I went through, but getting at some of those thoughts or those cognitive distortions that I talked about earlier, like catastrophizing. So the basic premise of CBT is that something happens. I interpret it with my brain. I think about it, which makes sense, right? I feel some emotions, and then I behave in a certain way. So, and this all happens in split seconds a lot of the time, and we're not even often aware of what our thoughts are. So if you think of your brain like a cell phone, there's a lot of things going on in the background, right? Your phone is, tracking your location if you have that on. There's news apps that are looking for stories that you might be interested in, popping out a notification. I keep getting a reminder that I need to, do X, Y, or Z from another app. And so we have all these notifications, right? So we have that red dot of things, and it's like, okay, but I don't want to know right now. I don't want to, have to think about all the notifications, and each app has its own little bubble of like, you had 19 missed calls. And so the nice thing is that we, like on our phones, can also control how many notifications we're getting of all the things that our brain is keeping track of. So as a caregiver, you have all these things that you need to be doing and paying attention to. And if you had to focus your attention on all of those things all at the same time, your brain would just, shut down. It'd say, I can't do this anymore. It'd be overwhelming. And sometimes you've maybe felt that way. So you can go into your notification center and say, I don't need to know all of this and think about all of this all the time. And I would say usually when that notification center breaks down a bit, or those controls, is at night when you're trying to go to bed and you're laying there and it's like, oh, let's think about everything now. Let's bring up all those notifications. So you can control this, but it takes some time and practice. So telling when your mind is going like, here's, oh my God, I got to get this ready. I got to order this. I got to set up this appointment. I got to, make sure, I have the right equipment. I got to replace these things, all these tasks. And you're just like, your brain is going faster than you can keep tabs on. Sometimes people even imagine a stop sign or just telling yourself stop. Take some of those deep breaths, and then observe like, okay, what am I actually thinking about? And there's an immense power in writing stuff down. Because if I don't write it down, my brain is trying to kind of simultaneously hold on to and remember and process a whole lot of information. So I love to keep task lists. If I don't, I start to feel discombobulated, like, oh my God, I'm missing something. So I write stuff down, and that's the most basic thing, but we can also look at situations. So what was going on? How was I feeling? What was I thinking? What did I do? Did it work? And what else could I have done? So this is a nice way to get at automatic thoughts that maybe aren't so helpful, and then being able to look at them differently. So this isn't something that comes naturally to people. So a caregiver will be meeting with me and they'll tell me about a situation that they were in that was really stressful. And I'll say, well, what were you thinking, at that time? And the response will be, well, I was really angry that so-and-so said that to me. And I'm like, that's not a thought. Anger is an emotion. What was the thought that went along with the anger? And sometimes people can't tell me. They're like, I really don't know. And so we call those automatic thoughts. And so these exercises of writing things down in the moment or, shortly after can help you be like, oh, when so-and-so said that, I thought this, and then I felt angry. And then I, maybe, told them off or walked away or did nothing, and it can turn off the automatic pilot that we often go throughout our days with. So stopping again, taking a breath, writing it down, and then evaluating my thoughts. So how useful is it? Is there an alternative way to look at it? Can I support it with evidence? I call it the Judge Judy test. My mom watches Judge Judy with my son. If I went to court with Judge Judy and I tried to argue my case of why I'm thinking this way and I couldn't support it, well, she would, roll her eyes and tell me I was silly. And so that can be helpful. If I can't back it up with evidence, then I need to let it go or think about it in a different way. How much control do I really have over the situation, including, is this a solvable problem? We spend a lot of time trying to solve problems that might not really have a solution, which is hard to sometimes accept. Am I underestimating my ability to cope? which I mentioned earlier, goes with catastrophizing. And, you know, what would I tell a friend? We're really good at helping other people, you know, and so if I gave that advice to my friend, why can't I apply it to myself? What is the difference between my friend and me? And so really that can be an effective strategy to come up with those alternatives to the thought that you might be having. Another strategy is replacing negative with positive. I'm not a power of positive thinking type of clinician or even person, but I do think it's a nice, you know, alternative to a negative self-talk. So I've met someone new, my self-talk is they won't like me. The positive or even neutral could be, let's see how it goes. Or they might like me, I might not like them. You know, why does it always have to be them not liking me? I might be the one to tell them, you know what, we're good here. So it's generating, you know, things that can neutralize feelings of anxiety or sadness or anger or things that, you know, we don't want to feel too much, because that's what contributes to that caregiver stress syndrome. Not just writing down your thoughts, like in a sheet like I put up earlier, or keeping a task list, but also writing has a lot of data behind it as its own type of therapy. And so we know that 15 to 20 minutes a day of what we call expressive writing, which is basically unloading whatever concerns you might have onto a piece of paper and a journal, can have different physiological effects on the body. It makes your immune system work better, reduces cortisol levels. There's a gentleman down at the University of Texas that does a lot of research on this as a treatment in and of itself. And so taking time, 5 to 15 minutes is all we're talking about, by, you know, really investigating your thoughts and feelings and just kind of writing. There's no format to this. There's no right or wrong way. Just write it down. I often recommend doing this at night before bed. We call it maybe worry time, like just unload your brain. And that way, when you try to go to sleep and your brain goes, hey, we need to think about that again, you go, nope, wrote it down. I can look at that in the morning and go over it and reflect on it, you know, for a few minutes at a time. I don't need to keep thinking about that. And this can be a really easy but powerful way to manage some of those concerns. It's okay to only write a few words. You can write pages, just write however you want, writing as if no one will read it, you know, just being not worrying about formatting, like this is not a homework assignment that you're turning in, you're just writing naturally. Whatever comes out, comes out. Also woven in with this is acceptance of life with a loved one using home nutrition. You know, it may be a temporary thing that they're living with. It may be something that's going to be going on for a very long time. And so accepting that this is going to be my life is a powerful thing, but also a difficult thing. When I talk about acceptance with people, they say, well, why are you telling me to give up? I'm like, I'm not saying that this is giving up. It's just saying this is not a entirely solvable problem where you can make this go away. So if you accept some degree of this, that you can understand that there's got to be a way through it, and I can figure out how to navigate life going forward, versus fighting that this has to change or this has to, you know, this can't be how it's going to be. And so how do I accept life with home nutrition? This is another area of psychology that has gotten popular in treating and working with people with chronic medical conditions, because we do have to accept, you know, I'm going to live with Crohn's disease probably till I die. If I fight it, I'm not going to be a very happy person. So instead, looking at what's life going to be like in spite of having this condition or having life with home nutrition. And I don't have time to go through all of this. This could be a talk all on its own, but these are the core constructs of acceptance, in that, you know, really I think the key piece is channeling your energy into things that are value-based or meaningful. So what's truly important, being present, not being ruled by your thoughts, and just really focusing on the here and now, and taking action to pursue those important things in your life that involve caregiving activities and involve not caregiving activities. And so what are those things that are valuable to you? So really thinking about what is really important, the most important things in your life. And everybody is going to be, different in terms of what their values are. But when I know what my values are, I can focus my energy on those things as much as I can, and that makes me happier. And so letting go of things in your life that might not be bringing you a lot of value, or even people that might not be, fostering this feeling of meaningful exchanges and things, can help you, because you have a limited amount of time, right? You have a lot of things on your plate. When you do have that free time, I want to spend it on something that's important to me. And that is not being selfish by any stretch. It's, no, this is valuable to me. I need this as part of my self-care. I'm going to spend my time on that. So really thinking about, what are going to lead to me having a rich and meaningful life. And so guess what? You can write them down. If you Google these acceptance and commitment therapy, there are many resources, and I've put some in this webinar for you to be able to find different exercises to go through and start looking at what matters to me in the big picture, what do I stand for, etc. And you can do these exercises on your own, so you can identify things that you can change. Also getting present. A great quick way to do this is to just pause and look around at 5 things you can see, that you can hear, that you can feel in contact with your body. So basically engaging all of your senses to be present in the moment. And I'll often have people do this, like sit down in front of a window, so you're looking outside, so you have something relatively interesting to be looking at, and just be present. And it sounds very simple, but again, in about a minute, your mind's going to start thinking about your, that you got to go pick up, pizza after work, and you got to, go to this meeting. And our mind is wonderful at wandering. So it's really training our brains to be present and in contact with all 5 senses in our way of going through life. Turning off autopilot, again, while you're doing different things. So if you're eating lunch or taking your dog for a walk or listening to music, anything that you're doing, just take a pause and be like, can I engage all 5 of my senses right now? And when your attention wanders, notice it, and then bring yourself back to what you're doing. Give this a try. It's harder than it sounds. I remember when we learned this in graduate school, I thought, well, this is easy. And our professor predicted very quickly, that very quickly we would all be like, yeah, no, my mind, as soon as you thought of something different, you had to raise your hand. And within about 90 seconds, the entire class would raise their hand. So this is hard, but with practice, it becomes easy. So here's some resources that hopefully you'll have access to later. Another buzzword is resilience. You may hear that in the context of your loved one, but it also is used for caregivers, and it's different than being numb or turned off to what's going on. It means you experience everything. You fail, you hurt, you fall, but you keep going. And so, like all the kind of buzzwords that become popular, meditation, now resilience, it is based in a long-standing science, that we are born, so humans are born with a natural desire to survive, so that is our natural resilience. Our adaptive resilience is how we've learned to change, or the trial by fire of life, right? What have I learned in life, and how has that adjusted how I act and do things and adapt, to my life. And then there's restored resilience, or learned, in that these strategies help tap into your natural resilient. So sometimes we lose sight of how resilient we are and how much we've been through and how adaptive we've become because we just feel overwhelmed, and our brains will filter that out. And so we can learn strategies to get some of that, resilience that we're born with back. Unfortunately, I'm sorry I don't have time to go into those, but I did include these 4 resources for how to do some exercises in tapping into your own, natural resilience that you have, that sometimes maybe some days it doesn't feel like you do. If you try these things or other things that I haven't mentioned, this is a short list of things to try, and you're still struggling, I would really, encourage you, if you haven't, consider meeting with someone such as myself. There are psychologists, there are social workers, therapists, master's level therapists who do specialize, like I said, in health psychology as a whole area of expertise. There are a lot of us. There are not going to be a lot that understand home nutrition. I wish there were more, but there aren't. But you don't need that specifically. You need someone that you feel comfortable with or a good fit. And, hopefully they've maybe met with caregivers. So they don't have to be necessarily home nutrition caregivers. But, if you find someone that has done anything with health psychology, then they will be familiar with the issues that caregivers face. Believe it or not, most insurance covers mental health visits without limits. That's a myth that has been perpetuated, I think, in a lot of circles, that insurance just doesn't cover this. And there are new laws, including under the Affordable Care Act, that make it supposed to be equal coverage for mental health. It doesn't always happen. Sometimes we have to fight with insurance companies, but overall, it's a lot easier. Not all therapists accept a wide panel of insurance, which is frustrating, but there are online databases and other resources to find people in your area. So if you're struggling with implementing these things, you might want to consider seeking help. And these are just some potential questions to ask. What's your approach to treatment? So I use cognitive behavioral therapy. Other people will use other strategies. You want to see what might be the best fit for you. How many clients have you seen who are caregivers? You have that specialty training in chronic illness. How long would I expect to work with you? What strategies, insurance, and fees. So you really can start with this today. Write a note to yourself with the key things you just learned. What sounds good to you? Do you want to use your smartphone? You can use it to get some of the apps I talked about, or some apps that you maybe find on your own that you like. You can set reminders in your phone to schedule meetings, if you will, with yourself. Don't dismiss them. A lot of people are like, oh yeah, I'm gonna use reminders, and they just say, ignore. It's like, if you're gonna use them, you have to listen to them. Make it a priority, like almost like a meeting with your boss. You wouldn't just be like, yeah, I'm not going to show up to that today. Really not dismissing the importance of some of these, scheduling some of these activities into your day. So being a caregiver, is difficult. We know that, and it can result in this caregiver stress syndrome. We really want to intervene before the emotional impact become overwhelming. Most people can do these self-help strategies on their own, but you really got to give it some time before you say it's not for me. Practice anything that you want for 2 weeks regularly before you make any assessment. And I really would say more like a month, but start with 2 weeks. Use the technology if you're comfortable with it, and then reach out to a professional if you continue to struggle. That's all I have for today, so I will hand it back over to Andrea, and thank you for attending, and I hope you found some of this useful.
Well, thank you so much, Dr. Taft. You've done an excellent job, really, in introducing us to some strategies of coping that we may not have known or even considered. We do have some time for some questions from our audience. If you haven't already done so, feel free to submit your questions in the question section of the toolbar on the right side of your screen. So I'll just maybe give anyone a minute to type in a few questions they may have for you.
Okay.
Dr. Taft, on the slide titled First Write It Down, the worksheet, is that available online?
Yes, there is. There are quite a few cognitive behavioral therapy websites out there that have all these worksheets that I would use with somebody in my work with them available online. So if you look up cognitive behavioral therapy worksheets, if you Google that, there's one out of the United Kingdom that's fantastic. It's a pretty clunky website, but they've got so many free resources. So a lot of this stuff is available online and it's free.
Great, wonderful. We have a question coming in. How do we find a health psychologist locally?
Yes, that's a great question. There are searchable databases that I direct people to. The easiest one is through Psychology Today. So if you Google Psychology Today Therapist Finder, it'll bring up that URL. You can put in your zip code. And then when you search your zip code, there will be filters that you can apply on the left side of the screen. And so you can pick your insurance carrier, and then you can also pick specialties, and you can check off things like chronic illness, chronic pain, medically oriented things are in that list. There's a lot of things: anxiety, depression, ADHD, all the things that psychologists do. So you can filter it by those few check boxes, and then you can look through the profiles. My asterisk to that is a lot of people will check everything in terms of their specialty. So some of them are not going to really be true specialists in health psychology. So you want to read the profiles and get a sense of how much they talk about medical problems. Like mine is full of, that's all I talk about is chronic illness and my, experience there. If they talk about everything, then it might not be what you're looking for. So you want to look through those, look for keywords of them talking about working with caregivers, talking about working with people with medical illness. They can do other things too, but you want to look for that specific mention in the text. So we all write a paragraph or two about ourselves. You want to look for it in there.
Excellent, excellent question. Do we have any other questions for Dr. Taft from our audience? Well, it looks like you did an excellent job answering everyone's questions during this presentation. And it looks like we are just about out of time anyways, so I would have everyone feel free to check out our resources page, Caregivers and Parents, for articles, presentations, webinars, and patient stories. And thank you, Dr. Taft, for an excellent presentation today. We appreciate you sharing your expertise with us. Thank you also to the participants for joining us today. We'll post a recording of the presentation on the Oley website in case you'd like to view it again. To view our schedule of upcoming webinars and past recordings, visit the Oley website at oley.org/webinars. And that's all we have for today. I hope everyone has a great rest of your day. Take care.